Are you ready to go? Yep, there you go.
And do you think? And do you think we've got everybody we want?
We've got a good cross section of them. Yes. So
it's only just 1 now, isn't it? It's only just 1 o'clock.
Yep.
What does that mean? That means
I'm not sure
that means they're not being attentive. Look.
Oh, it is. How interesting.
You're not paying attention.
It could just mean that they've not moved their mouse for a minute.
Because we can start and just say.
That I'm waiting.
Yeah.
Yep, and you can keep them all on mute unless you want them to say something.
Yeah. So is it best to keep them all on mute?
I reckon. Yeah.
Okay.
We generally encourage that they use the chat line.
Yeah. So I need to ask them to use the
questions in after.
Chat box, and that's email questions to you, isn't it?
Yep. So if they just reply to the email they received with the information, they'll come back to me and say, yeah.
Okay. So there's 8, including.
I'm there twice because I've sent Gay
Yeah.
side by thing.
And Rachel is, so there's 9 apart from Rachel, and Eleanor's there as well.
Okay. Sounds good.
All right. And what about when we stop? We'll just stop recording. I suppose you can come in here, can't you?
The broadcast is now starting. All attendees are in listen-only mode.
Hello. We're just waiting for the remainder of the people who are going to join us today. So please just hang on for a few moments. Well, hello and welcome to today's seminar. My name is Trish Williams, and I'm going to be presenting today on the RACGP Computer and Information Security Standards, and we're going to look at why they're important. So my role today is to be able to introduce the standards and also explain why they're important and how you actually go about using them and getting them started. First of all, I'd like to thank Rural Health West for inviting us to give this education series. There's going to be a series of 3 webinars. My background, as you can tell, I'm from the UK, but I've only been here for 29 years, so I'm not quite sure when I'm going to lose my accent. I first came to Australia to write the first clinical records package, the first medical record system, and decided that I loved it so much that I've stayed. My background is in general practice and health informatics, and I currently lecture at Edith Cowan University as a professor in medical information security. The company, as you will see, that I actually work for is called KISS Global, and we are and at the moment all women security company who look to provide business services to assist people with their information security. And I set that company up with two fabulous women who I hope you get to meet in the future, called Rachel and Eleanor. The company name is Computer and Information System Security, not to get confused with the KIS standards themselves, and we're not actually associated with the RACGP, other than the fact that I actually authored the security standards that we're going to go through today on behalf of the RACGP. Now, if you have any questions, please feel free to type those into the chat box, or you can send them to Laura and Sonia after today. Just hit reply to the email that you received with the information for the webinar, and they will be able to get those questions to us, and we'll send you some answers for those. So, today, looking at the overview of the RACGP KIS standards and why they're important. We need to get an understanding of the problem that we actually have. The area of information security is important because all businesses are open to information security attacks and risks. One of the problems that we have in healthcare in Australia is that people don't think that we have a problem with security because we don't hear about many major incidents that have occurred. And one of the problems with this is that without having heard of lots of different problems, people think that there isn't actually a problem. There's plenty of cases from the US of large-scale breaches of data, but in Australia, we don't hear of many in the news. However, they do actually occur, and the reason that we don't hear a lot about them is partly because we don't have a very high capability of being able to recognize the data breaches when they do occur. And secondly, we don't have any mandatory data breach legislation which requires organizations to actually report that they've had information security breaches. One of the objectives of using the RACGP security standards is it will not only allow you to make sure that your practice is more secure, but also will start to educate you on what you need to look for in terms of issues and potential problems that you may have in security. Now, I often think that security is much like swimming with sharks, because I, like Axl Rose, I always scream if seaweed touches me. But it's more about the fact that you never quite know how much protection you're going to need or exactly what you're dealing with. So we have to be prepared for either occurrence. And security is always seen as something that is very difficult to do. But if you have a good understanding of the importance of information security to healthcare and how you can assess to best practice, then you will make sure that you are much more secure. And also, obviously today's webinar and the following webinars are going to talk specifically about how you can use the RACGP standards more effectively to ensure that you're doing the right thing. So today we're going to cover what exactly information governance and information security is all about, why it's important, who should be responsible for it, which I'm sure as many of you on this webinar today are practice managers, you'll appreciate that most of the things come back to you being responsible, but also how you can use the standards effectively, how they're structured, where to start, and the very first two standards that are arguably the most important. So whilst it all may seem a bit daunting to start with, I come from the perspective that really information security is nowhere near as hard as this is my cat doing the Rubik's Cube. And there are ways and there is assistance that's available to you, which obviously is starting with the college standards. So first of all, what are we actually looking at and what are we talking about? Well, we are now in healthcare in a multifaceted context that is looking at the new e-health system, for instance, the PCHR, and how we do connecting for health. How do general practices connect to specialists? What is the sort of information that we can get that then helps the patients not have to retell the same story again and again? We work within a compliance environment. We have the new Australian privacy principles, which are going to be covered in webinar 3 in more detail. We have proposed legislation on breach detection and reporting. And one of the things that we also need to include in that compliance is a little bit of common sense. But within the context itself, we also need to account for the natural hazards as well as the technical and accidental hazards. A lot of issues that we have in information security are very much human-based, but also are not just mistakes, but accidents and things that people were not aware of, rather than any types of malicious threat. Unfortunately, within any system where you're transferring information, there's a lot of sharing going on. Technically, we can lock down that transfer of information, and the sharing is really not so much of an issue. What is an issue, though, is all of the endpoints to the health service, which is general practices at one end, hospitals, etc. And because these organisations are all full of people, naturally, that actually becomes part of the risks that we need to be able to look at and control. So why are we even looking at this? Well, there is an overarching requirement to ensure that you are doing good information security governance. And governance, the same as clinical governance or any sort of business governance, is related to making sure that you know what is actually going on. And to be able to do that, you have to understand what the risks are and how you meet compliance. What do you do? And do you know that you're doing the right thing? Are you completing the circle with doing auditing? And to make that happen, you need to make sure that you are mapping what it is that you're doing, that you are assessing it, that you have plans in place for how you deal with incidents and how you put good security in practice. And then where are you reporting that to? And who, in fact, is looking after all of that? The next thing is why we even need to do this. Now, these days, we all use computers for a number of tasks, whether you use online banking. I'm sure in your daily roles, most of you are using a computer, whether it's for a clinical system, whether it's word processing, using email. It's become part of what we do. One of the problems is that people are not altogether very aware of all of the impact and insecurities of what they do on a day-to-day basis. And increasingly, primary care is seen as the cornerstone for healthcare, which it always has been, but it has come much more to the attention of everybody in terms of security that we need to do more things and help primary care practices particularly, and allied health, in how we put all these things together. And that includes integrating with Australia's new, well, not quite so new now, but National Electronic Health System. And your environment looks a lot like this. There probably should be more talking to each other, but essentially a lot of what you do is done on electronic transfer, and the environment that we're actually working in therefore looks slightly different than it used to. And one of the reasons this is particularly important for healthcare is that we work in an environment of trust, and which is good in some cases with healthcare in terms of security, but it also causes us all sorts of problems because there is a lack of integration into workflow of the actual information security things that we need to do. And part of our work at CIS Global is trying to ensure that that integration occurs and that all the solutions that you're given are very practical and something that you can incorporate into what you do normally. And why is this in particular important for you? Well, you need to, your role in general practice or in allied health, or if you're supporting primary care of some sort, you are going to come across all of the things to do with security, and quite often you're asked about what should people be doing or what should the practice be doing, particularly if you're the practice manager. There is an evolving environment that we work in computing. It doesn't stand still. So even when you, I'm sure of any of you who have children or teenage children, particularly as I do, that the latest bit of equipment is what is required or what's wanted, and things in the computing field change very quickly. Unfortunately, that also means that all of the insecurities that we have also change very quickly, and that evolving cyber threat environment is becoming more and more important, because whereas if someone was to break into the practice, there's much more of a closeness to the fact that there's a physical person who's actually done that. Where we talk about the cyber environment, the people who are actually putting into effect some of those attacks may be in different countries around the world. So there's very much a removed aspect in that. Understanding the importance of information security, as I've already mentioned, is actually very essential to looking after practices, but also having that understanding is what is required for you to be able to assess risk of any sort. And ultimately, just being more aware and knowledgeable will make you much more secure. So, whose responsibility is it? Who should be doing all this? Now, hopefully, it's not everybody not looking around. For any of you who are together in one practice listening to this, I hope you're not pointing at each other across the table. By default, practice managers usually end up with the responsibility for overseeing this, although the owners of the practice or the doctors themselves should be that governance level and the responsibility up from that. But you also have a responsibility to meet legislative requirements, as well as a lot of professional requirements as well. Often when you need third-party technical assistance or something from outside, you still need to be very aware of what is going on and ultimately responsible for whatever you have contracted or got other people to do. But there is a lot of help and support that you can get from different professional associations. Obviously, these webinars are part of that today. And ultimately, who is responsible? Well, everyone is responsible for security, because in any way that you are connected with using the systems in a practice, any sort of information system, then you become part of that scenario that needs protecting. We often forget about people themselves needing protection from things like social engineering, but everybody has their part to play in putting together the puzzle for security. So how do we go about doing this? Well, in security, we usually try to split it up into sections that make some sort of sense, because the whole picture, as you're going to see for security, is absolutely enormous, going from the physical side of things to locking doors and making sure that air conditioners, for instance, are not placed over a server, to the remote types of attacks through a network that become very technical and complicated. So from a security sense, what we do, regardless of the environment that we're looking at, whether it's health or not, is that we split it up into areas that make some sort of sense. Now, with the RACGP, the way that we developed this was to split it into these particular sections, which the RACGP in the standards call standards 1 to 12. It gives you, they are sensible conceptual areas to be able to address security in particular ways. So you can see there, we're going to start with who is responsible and what do you actually need, and then how do you start with risk assessment. And in the following seminars, we're going to go through some of these particular standards based on the ones that you are most interested in. At the end of this webinar today, I'm going to ask you to think about the ones that, or the areas for you in security that are of most concern, so that you can tell us which types of things you'd like to have a look at in seminar 2. So all of these encompass the whole environment that you're working in some way or other, and we relate these to the different aspects of security. So when we look at the RACGP Computer and Information Security Standards, if you haven't been to have a look at them already, they're accessible from the RACGP website, and they are structured such that at the very beginning of the document it explains how you can go about using the standards themselves. So it comprises of a checklist, so a quick 12-point checklist for you to say, do we do this or don't we do it? Because one of the things you need to do, it's very because there's so many areas, it can be a bit overawing to say, well, do I have to do all of this at once? The idea of the checklist is to look and see what you're currently doing, and then focus first on the areas that you think you're doing most poorly at. Because if you've already got very good access control and use of passwords and system things, then you probably don't need to start in that area. You need to start looking at another area, perhaps mobile, where you either haven't addressed the issue or perhaps you're not doing as well. You then identify, using that checklist, the areas that obviously you might have the greatest risk in, and start with those. And then in an iterative process, you go to that particular standard that you need to start with, and you have a look at what it says that you should be doing and what level you need to try and get to. And I'm going to show you what one of those looks like in a moment. Within the RACGP standards, underneath each assessment criteria, which is provided in a matrix, you'll also find some explanatory notes and some implementation guidance for how you would even start to do some of those security aspects for that particular standard. So the standards themselves, the RACGP standards, also give you some education in that area as they go through. And then there is an accompanying document on the RACGP website that is called the templates, which has some useful templates and tables for you to use to record information that you're going to need. For each, what you then do is you go back for each of the different standard areas and then start addressing the next one. So you do things in a very incremental manner. Now, this is an example of what each compliance indicators for the standard looks like. So you will see there's a matrix down the left-hand side. There are some general headings that that I've split into the types of things that you need to do for that particular area. And then there you get to assess where you're up to with each of those things. And the box in red or in orange, depending on what it looks like on your screen, is where the RACGP have decided is the minimum level that you really should be at in a practice. The idea of these standards is that it gives you the opportunity to see where you are, but also tells you how you can improve, but in very small increments, so it becomes easier to manage. We're going to, using malware and antivirus, etc., is possibly one of those areas you want to have a look at next week in the next seminar as well, depending on where you are. So let's just take a step back. Where do you start in the first place? Well, the checklist has a question for each of the 12 areas. For instance, standard 2 looks at, have you undertaken a structured risk assessment of information security and identified the improvements? So if you know you've undertaken a risk assessment, or in fact you've had an external third party do that for you, then you can tick yes. If you're not sure, or in fact you're pretty sure that you haven't had it, then you need to click no. At the end of doing that for each of the 12 standards, you can then identify which ones you need to actually start with. And it gives you a good indication overall of where you're at in terms of the practice and the sorts of things that you're going to need to do. So initially, one of the most important things is standard 1. And do you have people responsible for managing computer and information security in the practice? And even if you do, are these people trained? Do they know what they're supposed to do? And what support are you actually giving them? This includes things, if you're engaging in the PCHR, you will also have some other roles that people have, as in the responsible officer and an organisation maintenance officer, that are required by the legislation or the agreement that you've signed with the government in terms of using the PCHR. So this is what the first one actually covers. So let's have a look in more detail at those roles and responsibilities. For each of the standards, you will see at the top there is an overarching aspirational objective. So for instance, the first one says our practice has designated practice team members for championing and managing computer and information security. And it is important to be able to document what people's role is with regard to that. Often people will say, well, you know, I'm doing this, but it wasn't my job to look after this part. So you need to make sure that within your roles and responsibilities, people are aware of what it is that they're actually responsible for, or what it is that they're contributing to that particular role. So when we look at the compliance, what we term the compliance indicators for that, you'll see that on every matrix there is a policy content and policy communication. Quite often you may have a policy. If you've been through accreditation, often the accreditation bodies will provide you some examples of those. But unfortunately, what happens is they then get relegated to a top shelf that nobody actually goes and has a look at. But it is important that your policies reflect what it is you're expecting people to do or how you're expecting them to behave, because ultimately policies drive what happens in an organisation. So you need to not only make sure that you've got one, but also that it's communicated to people. Most often now when people will join, well, staff join a practice, you may get them to sign a confidentiality agreement, for instance. Well, signing a confidentiality agreement needs that person signing that needs to know what that actually covers, and what does that really mean? Not just that I've signed one, but what does that mean to me as an individual, and what does it mean to the organisation? So it's important to be able to identify for the practice as well where you are on this matrix. So do you have a computer security coordinator allocated in the practice? And do they really know what to do? Are they given regular training? And you can see from this particular matrix, if you look across the line that is 1.3 computer security coordinator, it goes from an initial level 1 where nobody is really assigned the role officially, up to what we call the minimum standard, which is for this one is defined as level 3, where you have role assigned to a practice team member and the training is provided, right up to level 5, where they're assigned and there is ongoing training and activity reports to practice management, and the roles and responsibilities are reviewed regularly, at least annually. So if your practice is sitting somewhere in the middle at level 3, then that's fine. But what you should be doing is trying to get to one of the higher levels, because whilst a minimum level is a level that is reasonable to expect a practice to be at, in terms of good security practice, we would obviously like to see you at level 4 or level 5. The other roles that are within this particular one are the things that are associated with the e-health system, the responsible officer, the RO and the OMO, but also what training is provided. There is a requirement for engagement with the PCHR that there is ongoing training for each particular team member. So once you've decided who in fact should be looking after different things and what their roles and responsibilities are, the next most important thing before you actually get started doing any security measures is to assess what risk you're at. It's not enough to say, well, we aren't at any risk, because everybody and every organisation is at risk. But understanding those risks, even if you don't do anything about them, is better than not knowing what is actually going on. So for the compliance indicator to the RACGP standards, it requires that your practice undertakes periodic structured risk assessments, and also then can identify what improvements need to be made. Now, when we talk about risk assessment, we're talking about assessing what the risk is, then trying to see what you already have in place that controls that risk, and reviewing those particular controls periodically, because as I said, the environment that you're working in changes. You might change equipment, there is different things going on in the environment, and you need to make sure that you're responsive to that. And usually it means that you need reminding once a year to go and actually do that task. So that is our whole process of risk management. And the other reason it's important is that if you understand what those risks are, you're also in that process understanding what the threats are, both to the business and the clinical information. It isn't just the clinical information that's important in general practice or in any business. It's actually the business information that is also vitally important to protect and make sure you're looking after. The risk analysis then helps you identify what gaps you have in security, and also helps you decide what implementation strategies you need to try and address and fix some of those risks. Unfortunately, this I don't know that I can't even read this slide at the moment, but if you have a look in the handbook, in the actual standards itself, you'll see that for the risk assessment, there is a more definitive list of things that you should do, such as who are the staff's responsibility, what is actually assigned to which person, and do you have good contact lists? Do you have a comprehensive and up-to-date asset management register or an asset register? Those types of things are important, because when you have a lot of computer equipment and software, and in fact when you're using Medicare certificates, for instance, then you need to know what they are, where they are, and when they expire, for instance. Or if you have lots of software, it's important to know what you have, what the serial numbers are, and also who to contact if you have a problem. And all of those types of things would get recorded in an asset register, and the templates that go with the RACGP standards actually have templates for you and things they in Word, but you can download them and use spreadsheets as well to be able to record that information easily. It's important that you do that when you have new pieces of equipment or you install new software, so that you can keep that up to date. It's a really good reference. The other thing that then this leads on to is, how do you analyze the threats that you might have to your information? And generally you will see that threats are divided up into technical, natural type of disasters, etc., and human threats. And the human threats particularly are also divided into those that are malicious and on purpose, and those that aren't, so accidents and mistakes, etc. And you need to be able to cater for all of those different things. It's no good saying you've got excellent security against people not stealing things, but then you have your computer system right next to either underneath a air conditioner which drips water, or you have it somewhere near where if you have a natural disaster or it gets flooded, that the server itself gets flooded. So they're some of the things that I would probably call more common sense aspects, but you need to take account of those types of things and make sure that you are doing something about them, as well as the more technical cyber type of security threats. How are you monitoring that? And how are you educating people about what they should be doing and also the things they need to be looking out for? As I said earlier, one of the problems with detecting security breaches of any sort, whether it is more of a more technical nature or whether it is relation to things like the privacy principles, often people don't recognize that they've even had those sorts of breaches, and making people understand what they contribute to that is very important. When you are identifying the particular controls that you've got, if you've identified all of the different types of threats that you have, and the matrix, the templates that are provided in the accompanying documents to the standards give you a list of all of those types of things and the most common ones, and then there's space for you to add more in there if you want to. So as you can see from this particular purple colored matrix, it's saying for the human types of threats that are unintentional by insider or people who work within the organization. And when we talk about people who are internal, that is anybody who has authorized access, which may well include your service providers. So if you have a software support, for instance, from an outside organization, that includes those people because they have some sort of authorized access to your system. So it's not just your own practice staff. But the types of things that you have inadvertent access by staff, and what does that actually mean to the practice and to the systems? It may cause disruption, but also then what's the vulnerability and what are you going to do about that? And it also refers to, in that fourth column, suggested appropriate solutions and mitigation strategies, where to find in the CIS standards where to find that information and what you can actually do about it. And the last columns allow you to be able to monitor and assess for yourself whether you have some of these things in place or not. It is well recognized that you may not be able to do this risk assessment all yourself. Even if you can do part of it, you may need some additional technical expertise to be able to do the risk assessment. And that is quite normal. It's not that the practice is lacking a whole lot of skills they should have. Security is a difficult area, and it is more difficult than doing IT type of activities as well. So even though you might have IT providers, that doesn't mean to say that those IT providers are also experts in security. So you need to be able to get that information and that assistance wherever you actually need it. So one of the things about the standards themselves is that it is based on incremental improvement. So for instance, going back to the compliance indicators for malware, for antivirus things, you can see that if you currently do on 8.4 your updates, if you currently have to manually do the updates or tell it yes you want the updates to be done for your antivirus software, then while that is a repeatable process and it's okay, it's very dependent on someone doing it. So if somebody does that on a daily basis, then that is better than just doing it when anybody remembers. But if you move along to column 4 and you automatically have that being done on the various computers, that again is going to be more secure than if you were just doing it manually, which means it's a little bit like having a door to your house. When you leave the house in the morning, you usually shut the door. That is more secure than leaving the door open, because anybody walking past usually to an open door, it's an invitation to come in. If you lock your door, that is better again than merely closing this door, which is still better than leaving it open. If you have an alarm system on your house or on your door, that again gives you more security than just locking it. And if you have a great big dog that barks a lot, that's probably even better protection than just having an alarm system, which is better than locking it, which is still better than shutting it rather than leaving it open. And when we talk about security, we talk about these layers that we have. And often you'll see in these matrices that there is several things as you build up from level 1 to level 5. And that's about layering that security, because a little bit like Swiss cheese, one solution does not necessarily stop all of the different vulnerabilities that you have. So whilst there might be cases where having a firewall, which I'm sure most of you have heard the term firewall, will protect things from sometimes from things from coming into your system or from going out, it doesn't protect against everything. So having a firewall is not the security protection for absolutely everything that needs to go on. The same thing with antivirus software. Sometimes people ask me, well, I've got antivirus software and it's up to date, but I still got a virus. Well, the reason is that nothing is 100%, and antivirus programs can only pick up what they know about, and inevitably even the different types of programs that you have these days don't all pick up the same things. So ideally there is no 100% secure antivirus program, but they will pick up the majority of things. The best way is to have more than one, but one of the problems with that, and I'm sure if any of you have got teenagers who use their computers a lot, you'll realize that when you run antivirus software on systems, while we say it's essential to run it, it actually uses a lot of system resources, and particularly in the home environment can slow down the computer quite a lot, which is why people don't have 2 or 3 versions of different antivirus programs running at the same time, because there's such an overhead in processing everything that it becomes a little bit unworkable. I remember when my children some years ago decided that it was far too slow, the things they wanted to download with the antivirus on, so naturally they turned it off. But then, of course, we had to suffer the consequences of having thousands and thousands of viruses within about a couple of hours. So when we talk about this incremental improvement, it's about looking at what you're doing now and then taking small steps to make improvements. That doesn't mean to say you have to spend a whole lot of money to throw at security, but it does mean that you can start to assess where you are and also see how you can improve in a very stepwise process. So security is not something that you should, that you might be doing because you have more time. It's something that you absolutely must do. And using the RACGP Computer and Information Security Standards will help your awareness from an educational perspective, but also give you that guidance as to not just where to start, but how to do that improvement in a method that you can understand, but also in the time frames that you can actually manage. In webinar 2, you're going to look at measuring more of those particular aspects and those standards of security, in which case I'm going to ask you in a moment which sort of areas that you're actually really interested in. And so that's going to get into some of the details of, for instance, backup in webinar 2. And in webinar 3, we're going to pull everything together. One of the largest areas is business continuity, which includes how do you recognize that you've got problems, what is the most important things going on from a business perspective in your organization. If you have disasters, what are you actually doing about that? Do you know what you would do if you had a fairly serious disaster with your information systems? And then also, how do you continue to function in the business? And that's really what the business continuity part of it is. What plans do you have in place if you had a major disaster of some sort? The other areas that you'll cover in webinar 3 are about secure information sharing and what is it that's available in our e-health arena now and where is that going, and also taking a more in-depth look at the Australian privacy principles, because they apply to any organisation that handles health information. So it doesn't matter whether you are classed as a small business or you have a very small number of staff and a small turnover, you're actually still under those Australian privacy principles, and there are things that you need to understand that your responsibilities within those particular things. So from our point of view and from KISS Global, you can also contact us directly if you want to. Otherwise, send your questions, especially for this webinar series, to Laura and to Sonia at Rural Health West. And really, the point I really want to get across to you is that we understand that security is not your core business. Health and patients are your core business, and therefore it's very important to find solutions that help you and that fit into what you do on a day-to-day basis. And really, information security is not all that hard. If she can finish Rubik's Cube, then you can do information security. So for today, that is the formal part of the webinar over, and we'd like to see if there's any questions from anybody at the moment. I'm not sure that there has any been, let me have a look. Questions. Oh, okay. What I might do is turn on, I'm just going to technically get some assistance from Laura. Laura, can we turn everybody's microphone on? That's mine. Attendees. And unmute. I'll just do, I think you do that one. No, maybe not. At the moment, we're trying to unmute you all, which may not be successful. Okay. If anybody, can we just go back to questions? Yes. I need to ask people what sort of areas you would like to cover from that list next week. So if anybody wants to just type in what they, the sorts of areas they would like to have a look at, that would be helpful. I think most of, oh no, I've managed to unmute most of you now, so okay. So I can probably hear you all now. So does anybody have any other questions or suggestions for what they would like to have a look at next week?
Oh, hi, Guy here.
Hello?
Sorry.
That's all right.
It's Guy here, Trish. I'd like to see business continuity standard 5. That would be great.
Yes, and that's going to be covered in webinar 2 and 3 anyway. Gail, and
Okay, cool.
yeah, those types of things. It is one of those very large areas that you need to get your head round, and it's not an insignificant area to try and address.
Definitely not.
Joshua put the question about having just gone through 2 accreditations. I'm really sorry for you. If you've just gone through 2.
Thank you.
I can understand why you might seriously need some help.
I should go to Hawaii now for holiday.
I think you should come with me. I'm about to go to Paris to do some work, so maybe you should come with me.
Oh my goodness, that would be a good one. Now, I have an IT Cert 4 in IT.
Yep.
And I think that really helped me with this. I think somebody that is not really very vast with IT will have problem with the system. It's so intense and very, very. So how do practice managers get help? Because they will seriously need help.
Yes, I agree with you.
Instructor or somebody that can do that for us?
There is. Usually, practices would first go and talk to their professional organisations, but they don't necessarily provide the assistance they need. So, first of all, I would suggest that that they really need to contact us as KISS Global. Because
do you do that contract for people?
We do, and also help them to be able to work through the RACGP standards so that they can actually assess where they are, but then also use that for the accreditation as well as then planning for what they need to do. So they just need to contact us at KISS Global, and absolutely more than happy to help them and work out what actual assistance they need. Because if they need someone on the ground in more technical assistance as well, then that can also be arranged.
Okay, do you have a website, please? What's your website there?
The website
for KISS Global
is KISS Global. So www.kissglobal. I really wanted to call it PASH Global, but the girls wouldn't let me.
Okay, no problem.
Louise put up a question about looking at what we need in place in our policy and procedures, and that is a really important area, Louise, that we can certainly cover in the next week as well, because a lot of practices, as I said earlier, we all think we need to have policies, but people are not very good at developing those for themselves, and policies need to be tailored to what you want to get from a business perspective within the actual environment itself. So it is very important, and we can certainly cover those ones next week.
Sure. Trish,
yes.
You earlier you talked about training, kind of similar to what the gentleman was just speaking to back then. With regard to, we should be training our coordinators to be able to do their role. My question is, train them in what and how and
who do you get them to? The level for the people that you have within a practice or within an organisation really needs to be, do they know how to oversee that particular aspect? So initially, for instance, we would suggest that you had some sort of training from doesn't have to be us, but from someone like us who explains what types of things they need to be looking at, but also then who they can go to get whatever help they need. Because part of this problem is not that they couldn't do it, but they don't really quite know where to start or who to contact. And being able to recognise what the risks are and the things that you need to manage is the very first step. And that's also often, as you point out, quite difficult for them to do because they don't know what things they should be looking at. When you look at the media, there's a lot about the cyber threats and etc. But often it's the internal mistakes that people do that are the most difficult things to deal with, but also create the most vulnerabilities. And it's knowing those sorts of things. So again, I would say you probably need to contact someone someone like us to say, well, what is it? You know, what training can you provide? And we would then analyze with you what it is that you actually need to have and what it is that they need to know.
Sure. Okay. I take it that's not a free service. That's.
I mean, but trying to help you work out what it is that you need. Obviously, you know, we would just help you do that, because part of this is, you know, part of this is actually us helping what people work out what it is they actually need, and using the resources like the RACGP Security Standards is one way to be able to do that, and we can certainly help through that.
So you would be able to potentially provide a webinar for practice staff to understand about security and what, you know, just how to operate safely within their normal working day?
Yes, yeah. And that can be either from, you know, like a webinar type thing, or, you know, whether it's a webinar or a teleconference type thing, or even coming to visit you. I mean, we're actually based in both WA and in Sydney. Two of the company actually live here in WA.
Okay, no worries. Thank you very much.
And whereabouts are you?
We're in Geraldton, WA.
Oh, okay. Yep. Everybody says I live in South Geraldton because they always complain about having to reach my house, I have to tell you. So I'm a few hours away from you, but maybe closer than other people.
Right.
Way north of Joondalup is what everybody says.
Or something like that?
No, only just sort of north, not quite as far as Mindarie, but for people who live in the city, they always say it's a long way.
Terrible.
Yes.
Fantastic. Well, thanks for that.
You're very welcome. So does anybody else have any suggestions for different things they might like to cover in the next one? In the meantime, just by all means, just email either us or Laura or Rural Health West and give them your ideas, and then we can tailor what we actually provide to you next week in terms of what it is that you're actually interested in.
Yeah. Thank you so much for that.
You're very welcome. I'm aware that it's 4 minutes to 2 and that some of you might need a coffee before you have to go back to work.
Definitely.
So thank you very much for joining me today.
Thank you so much. Yes,
all right. And have a lovely rest of your day.
Yeah, thank you.
Okay, bye-bye.
Thank you.
Bye.
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 Thank you.